Hello. Today, for today's model, we'll be talking about health promotion and behavior change interventions. And as usual, we have the learning objectives. For the first one, we are going to talk about, healthy behaviors and the contributions it has to burdens of diseases in the U.S. And then discuss health promotion. And finally, we are going to talk about evidence-based health behavior change models. So with the learning objectives, you guys may or may not have seen this diagram, and what this diagram does was to basically look at the different determinants of health, whereby a lot of that is social determinants of health. It has where it's saying that socioeconomic factors make up 40% of what determines what our health outcomes are, with 10% being physical environment and 30% being health behavior. However, another study did find that when it comes to risk factors that impact premature death, we kind of have health behaviors taking a much larger weight than it did when we talked about behavior social determinants of health, where we have behavior change contributing to 40% of the risk factor, and which is the largest impact of all the other factors that were considered. So basically, that kind of shows us that this individual determinant, individual health, sorry, individual behavior plays a lot of role in what our health outcome is, especially with relation to mortality. And this is a study. This is an outcome of the study from the year 2000 that basically looked at some of the leading causes of death in the US. And you have smoking, really carrying the weight of that, and then followed closely by obesity and inactivity. So a lot of this causes of death, as you can see, a lot of that is relying on individual determinants of health, playing quite a high role with sexual activity, sexual behavior, alcohol, drug induced, and obesity and smoking. They have a lot of impact on health. And then we have what we call the four big health behavior: smoking, physical activity or inactivity, as may be. And then you also have alcohol consumption, and then nutrition and diet. And we can imagine that this has a lot of impact, and from what we see in this causes of death is kind of reflected on evidence. So you can go to any of these links. They kind of discuss in details how these big four kind of contribute to premature death, and just basically our health outcomes. So that's that for learning objective one. Then for two, we are going to go right into health promotion. So, having talked about the contributions that individual behavior has on health outcomes, you can imagine that as it relates to population health, there's a lot of emphasis that goes into trying to improve behavior change, trying to encourage healthy behavior, and that's a lot of attention that goes into it, and some of that is done through health promotion. Some, of course, those some of them are done not during health promotion is kind of on the preventive side for the most part, and but you do know that there's a lot more that goes into healthcare, where you have like what we talked about the last module in terms of primary, secondary, and tertiary. But health promotion really works kind of, it is the domain of primary care. And with health promotion, is defined as a process in which enabling people to increase control over their health and determinants of health for quite much of the types of different health promotion interventions programs we have, a lot of it targets individual behavior, and a lot of that tries to get individuals to change their behavior. But this is not to say that all health promotion programs are all targeted towards individual behavior, but quite a lot of them are, really focused on individual behavior. And then we have the health promotion programs, being comprised in two levels, where we have one is providing health education, and the other one is, looking at environmental factors to support conditions of healthy behavior. An example of environmental actions would be things like maybe lobbying for policies to have fast food places not be very close to schools, whereby students will be, tempted to go and just get that instead of eating cooked meals and stuff like that. And another one could be, getting the community to really work towards, coming up with a community gardening and stuff like that. So those are kind of the environmental actions. And then we have the health education, a lot of self-management programs or interventions kind of rely a lot on health education, where you are kind of teaching people things they need to know, in the hope that being informed does help them in, doing health changing their behavior. Of course, it's not as easy as I'm saying it. Changing one's behavior is not easy, and so, but one we kind of try as healthcare providers. So with health education, we're looking at campaigns, social media, and then with environmental factors, we're looking at advocacy, social support, community programs. If you're trying to kind of want to tell the difference between the two. So, but something to pay attention to when you are designing interventions is, first of all, you really have to put a lot of time into determining what the social determinants of health is, and what the social determinants of health you will be targeting for that interventions, and trying. So you need to, first of all, identify the population, and then look at the social determinants of health. For the most part, because you kind of have to defend the reason why you are choosing those social determinants of health, you will be looking in terms of health outcomes, let me say prevalence rate, incidence rate, mortality rates. Those are the health metrics, indicator metrics that you could use in justifying the reason why you are choosing the social determinants of health. And of course, you have to come up with, the process, how that's going to work, and, find a way to integrate it into care continuum. But another thing you want to do is that you have to understand there's something called diffusion, whereby you have change agents who are the early adopters of this health behavior change that you're trying to promote, and they being the ones to kind of push for it, and more or less like it's kind of on an organic way of getting people to kind of influence their actions. But you want to identify who your agents are, change agents are, to be able to equip them to be able to push for diffusion on collective collaboration or collective impact. And so we're going to quickly go into the behavior change models. There are a couple of them. There's a lot of them, and but some of the ones you want to kind of know is you have the health behavior model, which really we use a lot of that. Health belief model. There's one textbook that I had on health belief model. It was a hefty book, and I think health belief model was one of the earliest that we had, and try to kind of understand what happens in terms of getting people to change their behavior, or trying to explain the reason people have the behavior that they have. And then we have the trans theoretical model, we have the theory of reason actions, and then we have the social cognitive theory. So you can see the definitions of these different models, and if you click on these different definitions, it will take you to papers, academic journals, where you can read more about these behavior models, if you really want to go much into it. But for the sake of this class, we are going to focus on the health belief model and the trans theoretical model. So this is what the health belief model is in a nutshell, where you are looking at perceived threats, and you're looking at perceived benefits, perceived barrier, and oneself efficacy. So it really tries to look at, how do we, it says these are things that influence people's behavior, perceived threat, benefits, barriers, and self efficacy. How do we work on those different things to be able to have our health behavior? And you then also have cues of actions, the things that encourage people to have those health behaviors, which, hopefully then leads to the desired health outcome that we want. So these are some of the examples that you could use in trying to understand these different components of the health belief model. And then, a number of examples that came from COVID. It really, really talks, based it up. You have a perceived benefit of action, personal influence, and all of that. What you want to do is to make sure that one's perceived benefits and one's perceived actions, barriers, are kind of, you want the perceived benefits to be higher than the perceived action. So you may want to look at into pushing more of the perceived benefits, having people concentrate on that rather than the perceived barrier. And of course, you want to make sure people have a self efficacy, to feel confident that they can, you know, be able to do this behavior that is desired, that they are able to make decisions in terms of, I can do this, or this is one of the things I can do. You have an example of that says, I'm sure I would wear a mask if I had one in my car or in my purse. I can do that. So there's some kind of self-efficacy that comes into being conscious that I can have a mask in my purse, I can have a mask in my car. So there is that kind of self-efficacy, or kind of self-confidence in knowing that, first of all, I'm able to remember to put all of these items in, different places that I want to put it in. That makes it easy for me to reach when I want it. And then we have the trans theoretical model, or stages of change, where they are basically saying that there are five stages, and one goes through that in before one could get the behavior that change. This is not to say that it's always in this order. Sometimes you move from pre-contemplation to contemplation, and then you go into action, you come back. Maybe the action you took kind of did not give you the result that you wanted, you come back to preparation. Or you could there are different ways that it can happen, based off on whatever results that is giving you. And but either ways, that is, then we have a number of examples in terms of how that works. With these examples, we are kind of focused on alcohol abuse examples, so that you kind of know the different ways that this behavior change models kind of operate. So this is the end of today's module. Please always use a Q&A board if there's any part of this class that you didn't understand, or any of the reading materials for the module that you kind of didn't understand. And I'm always very willing to explain it. And do have a lovely day.